Kia koutou, morena, and welcome to this hui. I'd like to ask our kaumātua, Frank Solomon. Frank, would you like to start and bless our hui this morning, please? Kia ora, and just take your microphone off mute, Frank.
Oh, koti.
Kia ora.
Tēnā tātou, he honorere korori ki tātua, maungorunga ki te whenua whakaaro pai ki ngā tāngata katoa. E tō mātou matunui te rangi, anei māti inua tēnei kia koe. Māurau e āwhina māti I rotu I tēnei kaupapa nui o tātou ke mui a tātou. Kia rongorongo tātou katoa ki ngā kōrero o ngā tāngata katoa pāni tēnei. Mate, ka tuku atu tēnei inui I runga tingoa tā atu maiti o ihu karaiti. Āmene. Kia ora tātou.
Kia ora, Frank. Thank you for that. Look, firstly, I apologise. I've got builders in the house. It's very untimely. Hopefully, it's not going to be too distracting, but I'll mute whenever, as much as I can. So I just want to introduce myself. Ko te rarawa, te aupori me Ngāti Kahunga Iwi, ko ora whana te maunga, ko rangihiki te awa, ko manukau tuku marae, ko makarena dadi tuku ingo. So I, along with Teresa Wall, a co-chair of the Dementia Mate Wareware Leadership and Advisory Group, Te Whakaruru hau mō te Mate Wareware. And welcome to the hui this morning. The advisory rōpū has been brought together to provide advice to the commissioners for the budget, the 2022 budget, and we have made recommendations. Well, actually, we've been invited by Te Whatu Ora and Te Akawhai Ora to provide advice to government about the commissioning process, and I think Matthew's going to be talking about that in depth. We've had a number of meetings over the last 6 months to get to the point where we are now, with obviously lots of consultation with the network, and so hopefully we will have an informed morning. And I think I might just leave it at that. I will allow Teresa to, not allow Teresa, I'd like to now invite Teresa to introduce herself. Ngā mihi.
Oh, hang on. All right. Tēnā koutou, ko Teresa Wall tōku ingoa no te rarawa me te aupori ahau. And I'm the co-chair with Makarena, and it's very nice to be again meeting with the network, or being part of the network, actually. So as Makarena says, we've had a number of meetings, both with you guys and with ourselves, looking at what we're going to be doing, and particularly what we're going to be doing in the future. So that's the purpose of this meeting, really, is for Matthew, who is the deputy chair, to provide you with some information about what we've been discussing for the focus of the leadership group for 2023-24.
The areas of focus the government has indicated are support, focusing on community supports available for people who have recently been diagnosed with dementia mate wareware and their whānau. And there is, the government has stated that priority will be given to meeting the needs of Māori, Pacifica and rural people, as well as people who are affected by mate wareware at a young age. The second area of focus is navigation, and that some people who in whānau are affected by mate wareware dementia may benefit from a guide, which I think is an excellent idea. Hence the reason why we've kind of gone through with that, a guide to link them to the supports and services that can help them. And this is a cry you often hear from people who have recently, been given a diagnosis within the whānau. And of course, lots of, and respite is a third area of focus, which we are hoping to generate some expenditure into and looking at maybe some more novel ways or innovative ways where whānau can access respite care, and where respite care is tailored for the needs of whānau rather than the other way around.
All right.
I go too much,
from
Cass.
Bevan. Is he in? He's in. Matthew.
Well, kia ora, kia koutou. Good morning, everybody. I'm very sorry that I had a little technical difficulty there. What I'd like to do is just reorient you to what are the actions in the Dementia Mate Wareware Action Plan, where do they fit together, and what are our next priorities? And that's what we're going to spend the bulk of today's meeting talking about. So I'm just going to share my screen so that you can see. And I'd love it if you could give me a thumbs up, Teresa, if you can see that clearly. Great. So the question is, where do we start from here? Where do we start in the country to try and work out what's going to happen next with the Dementia Mate Wareware Action Plan? The way to think about it is to start right back in 2013 with the framework for dementia care, and the way it mapped out for us a way of thinking about the dementia journey. So everybody in Aotearoa, New Zealand, is either in the life before dementia camp or in the dementia camp. Not that all of us will develop a dementia, of course, but we can think of ourselves as not yet having it or achieving the diagnosis or going through until we die with our dementia. That's the main contribution to us today from this initial thinking in 2013. But the framework must now bow to the action plan itself. So as we look at the action plan, there are 4 priority areas where the different action points have been laid out. They are reducing the incidence of dementia. We want to flatten that curve into the future. They are all the different things that we need to start on now to improve the system so that we are better supporting our people living with dementia and their whānau, their families, their supporters, and their care partners. We want to pay attention to the whole community so that it has a better understanding of dementia and therefore can better support our whānau living with dementia. And we want to strengthen the sector. And for many of us in this digital room today, that's us, the people in private businesses and primary care and NGOs and whatuora and takawhaiora who are working to support people with dementia. So there's another way of thinking about all the different actions in the plan that will help orient us in our discussions today, which I'll present to you just after reminding you that the government has said, this is good, we're committed to this action plan, but start with 4 priority populations. Start really trying to get it right for Māori, for Pacifica communities, for people with young onset dementia, and for people living with dementia in rural New Zealand. So if we just lay out all of the different action points, this is what we end up with. We end up with those stages of the dementia journey. Some action points go across all 5 stages. For example, forming this dementia ecosystem, which is the top issue there from the action plan, the national government to governance structure to progress the plan. That's us. That's what we're doing here in the ecosystem. But some of them fit within some of these stages only. So, for example, improved palliative care of people dying with dementia fits at the end. So those 4 different priority areas within the action plan map to these different points and stages like this. So reducing the incidence is one of those things that's going to affect everyone at every stage of the plan, but it's going to particularly have some impact on a brain health or a whānau order public health strategy and on a dementia awareness campaign. The bit that's about supporting people to live their best lives is going to be in these boxes at the bottom, things like improving respite, like Macarena was talking about before. The bits of the action plan that are about building accepting communities are really around the dementia awareness campaign that the plan talks about, the supported decision-making work that the plan talks about, and then a whole bunch of things in the top box that span all those 5 parts of the journey. And strengthening the dementia sector is in the top box. It doesn't mean it's simple, it just means that it crosses all of those parts. Now, some people might notice that the minimising dementia harm section doesn't have that much specifically attached to it. And that's not because it's not important, it's because that's where a lot of the current focus and funding is going. For example, funding older persons' mental health or psych services for the elderly services around the country to help people when the ride gets very bumpy. There's more to do there, but this action plan says start off by focusing on those other areas first because they are most in need of being beefed up. Now, there is work currently going on in these areas shaded pink. So, for example, we have a national governance structure. That's a piece of work that's largely been ticked off. For example, attention given to special populations is something that government has said start here with Māori, Pacifica, rural and young onset dementia. For example, the process that you've just been engaged with helping the leadership and advisory group on is deciding on the seed funding from budget 2022, the $12 million that's going into pilot projects for 12 months of post-diagnostic support. So a start has been made on all those areas, but where to next? And this is where the Dementia Leadership and Advisory Group, after just a very brief conversation with you at the last meeting, put their heads together and thought that the next 3 areas to focus on, the next cherries from this tree to focus on, will be the brain health, whānau ora prevention or health promotion strategy, paying attention to how can we meaningfully support primary care to do an even better job with timely and accurate diagnosis, and focusing on the workforce. How can we boost up the workforce, both in particular for Māori, but also for everybody else in New Zealand, so that we have a better trained workforce where its capacity is strengthened and protected into the future with our increasing demand. So this is where we're starting, folks. The Dementia Leadership and Advisory Group is suggesting that the brain health whānau ora part of the Dementia Action Plan is one of our next key areas of attention. Secondly, that meaningful support for primary care to make the diagnosis and an initial management plan is a key part of the action plan that we need to pick off now. And thirdly, that we must start focusing now on what we can do with Te Whatu Ora, Take Whai Ora, and Tohatoha Te Waiora, which is the Workforce Development Council. What can we do with these groups and with our universities and polytechs and everyone else to really strengthen the workforce and develop a strategy, both in terms of recruitment and retention, but also in terms of training and support? So, ladies and gentlemen, I'm adding my welcome on behalf of the Leadership and Advisory Group, of which I'm a member, to you all. And I'm encouraging you now with the next part of our meeting to really drill down into these 3 areas. So what we're going to do now is have a sort of town hall question and answer session. So I'm going to stop sharing my screen and just be available as your first point of call for any questions that you have about these priorities and about how does this fit in with the whole work that the network has gone on so far. And we've got our 2 chairs here as well, and we have other members of the Leadership and Advisory Group here. So we're here now just to answer any questions you have about the process so far, the priority areas, how it all fits together, and then we're going to be breaking into special interest groups to start drilling down on those 3 top priorities and what they might mean, and what your advice to the leadership and advisory group will be for its next meeting next week, where we try and actually set some plans for this. So I'm going to hand over to the people facilitating our meeting today to be passing on any questions or points of clarification that you have about these priorities and how they fit into the whole plan.
It would be a good idea if people could write their questions in the chat. So if you can see down the bottom of your page, there's a bit called chat. If you click on that, it enables you to then write down your questions, and that way we can follow them through one by one, or Matthew can follow them through one by one. So if you could write any questions you have in the chat.
And I hasten to say that there's no such thing as a dumb question. And if you're new to the network meetings, don't feel terribly bad if you're thinking, hang on, what was that budget money, or how does it all fit together? All right. So we've got questions flurrying in now. Stephen, shall I just have a go at seeing if I can start to provide some answers?
Yes, if you just start from Caroline and work your way down.
Indeed. So Caroline has said many countries have a dementia training framework. Might this be something worth considering? So the action plan talks about a dementia workforce strategy needing to be formed for Māori in particular and for the population as a whole. And that is a training strategy might well be part of a total workforce strategy. In other words, it's not just about recruitment and retention. So that's a great idea.
Can I just add to that, Matthew?
Yeah.
In Australia, I know and I'm sure in other countries as well, there are postgraduate university programs for training people specifically in the area of dementia. That is something that I don't know why we don't have, and it is something that I would love to see introduced into our university system.
Mm. And then we have Francis Blythe, thank you, Francis, saying, what does diagnosis mean in this context? What does it encompass? So it'd be fair to say that in terms of how the Dementia Action Plan was written, diagnosis is seen as a medical gateway that opens the door to a person's access to services. Because that's the way our health system and to some extent our social services system works in New Zealand, that diagnosis is the key that unlocks the door to funded services. And when I say it's a medical process, I don't mean it's restricted to GPs. I mean medical in the sense that medical services, which includes in primary care, nurses and general practitioners in allied health, and in secondary care, the hospital system includes those same groups. So it's making a diagnosis, and the point is to open the door. And we know that in New Zealand, there are barriers for people receiving an accurate and a timely diagnosis of dementia mate wareware. We've got another point here from Katrina Fletcher saying, I had a call yesterday from a spouse who's at her wit's end, 15-something delay for NASC for reassessment, could be 15 weeks easily in this country. It'd be pretty unlucky to be 15 months, but I know that there are 12-month delays in this country. So, and she can't find respite, and her husband has dementia and Parkinson's. So, the action plan, where it would touch on this problem, because it is a problem, delay to get services that are already out there, let alone there might not be services available. So the action plan touches on that with its attention to trying to improve access to respite services and trying to increase access to 12 months of post-diagnostic support. Those are the two main actions in the action plan that touch on this. But those special populations have extra barriers, rural, young onset, Māori and Pacifica, so they have extra barriers over and above what everyone else who's not in one of those important groups faces. And so they are particularly targeted in what government has said we must focus on with this first action plan. So all I can say is it's on the radar, and that's where the action plan's priorities touch that question. We've got another person saying, would a workforce strategy include a strategy for training of so-called informal carers? What a great question. So one of the buzzwords in the sector and in the literature is this phrase informal carers, by which we mean the people who provide the bulk of the care in New Zealand for people living with dementia, and that is whānau, and occasionally other people who might loosely be encompassed in whānau, like next door neighbours and best friends and people down the road, who are also part of the network for our precious people with dementia mate wareware in this country. So that's a good challenge for the leadership and advisory group, is to not forget the unpaid workforce who are managing the bulk of the care of people living with dementia. So thank you for that challenge, Paul.
Can I also add my 5 cents worth to that? This is probably where I get the most inquiries from, is from whānau, family members, as you said, friends, neighbours who are struggling, who don't have formal training in terms of caregiving. And I'm delighted that we will take up this discussion in subsequent meetings. I don't know where it fits into the action plan. Matthew, you might actually, you might know, but I think as I agree with Matthew, this is a great question, and thank you for raising it.
Yeah, I think that's a good challenge for us to make sure. So obviously there are some things going on around the country now. They extend from the dementia NGOs, so Dementia New Zealand and Alzheimer's New Zealand do a lot of training and education and support work for whānau, but they want to do more. And secondary care does some as well, and primary care does some as well. But you know, these are important parts of a solution rather than being the complete solution. So, and I think finally, before we break for our groups part of the morning, there's a comment about just not forgetting the aged residential care sector in all of this. And the aged residential care sector is absolutely not forgotten in all of this. So one of the points in this great comment was about don't forget the workforce in aged residential care, and we're absolutely not. That is, along with the home-based support service workforce, the largest workforce working in the dementia sector in New Zealand. So it's absolutely on the workforce strategy radar from the Dementia Action Plan. But the other comment there is there's some concern about, are we building enough aged residential care beds, if you like, for the future, let alone the current demand? And the particular point in the question was, what about specialist dementia beds? So we know around New Zealand at the moment that the demand for specialist dementia aged residential care beds is much higher in some areas, and on par, but not well below in some areas what is actually supplied. And we know that although there's a big boom in building aged residential care in New Zealand, most of those beds are not dementia specialty. But bear in mind that we think that most people living in general rest home and general hospital beds are living with a dementia. So yes, we need more dementia specialty beds, but we actually need more general beds. And we need them to be expert in helping our people with dementia too. So it's a great point. It's not forgotten in the workforce strategy. Now, ladies and gentlemen, that is just a brief town hall questioning
Matthew,
exercise. Yeah.
Matthew, can I interrupt? Because we had a late start and there's so many questions
Great.
in that list, we could go on for, we asked Matthew to keep very strictly to time and finish at 10:30, which he's done, but we could go on for another 10 minutes perhaps, and
Okay.
just give people a bigger grounding for their discussion later. I see a question from Kristen Phillips, saying it would be good to hear a bit more about the thinking behind these 3 priorities chosen by the leadership group. Why these 3 in particular? Because I think that kind of sets the stage for the discussion later and any other questions you can pick up in that 10 minutes.
Yes, thank you, Shireen. And just to let everybody know too, that the questions that that the chairs and myself are unable to get to today, we will try and collect them as best we can and answer them on the website. So why these 3 priorities? Just let me share my screen again so that we can just have them up, and I'll explain a little bit about my understanding and get comments from my colleagues about their understanding of why these 3 priorities. So, because they're all good, right? Every point in the action plan is important. And the things that are even not in the action plan, it's not that they're unimportant, it's just that they have already been prioritized by you, the sector, actually, when we went out to consult some years ago in 2019. The areas in the action plan are all critical, and yes, there are other important things, and they may well be in the 2nd and the 3rd New Zealand Dementia Action Plan. But in this first one, the reason that the Leadership and Advisory Group has gone for these 3 points as the next priority is because of their strategic importance. So if you want to make a big impact, not a small impact, but a big impact on the future of dementia care in New Zealand, in other words, the deal that our citizens and their whānau are going to get with Dementia Mate Wareware, given the fact that we have an aging population and a projected very large increase in the numbers, the sheer numbers of people living with dementia in New Zealand, a little bit like we talked about with COVID, you've got to try and head off the curve. You've got to try and flatten the curve so that the numbers don't increase in their worst possible rate. Got to try and flatten that off. And the only way to do that is to prevent, to try and help people to stay healthier for longer. Now, this does not mean just delaying the inevitable, because there are many things that we might do to try and keep people's brains, bodies, and whānau healthy through the lifespan that don't necessarily change the day you're going to die. So it's not just pushing everything into the future. So now we have the same number, but they're 90 to 110 rather than 70 to 90. No, it doesn't mean that. If you can delay the onset or even prevent it completely for an illness like Dementia Mate Wareware, there will be significantly less people living with this condition. And to do that, you've got to start with that. You can't wait for 20 years and then come along and try and do some whānau ora and brain health work. You'll do it now. So it's a no-brainer that that should start now. The second thing is, it's great to improve services for people living with Dementia Mate Wareware, but if you haven't opened the door to people's access to those services, you'll only be supporting the people that have a diagnosis. You won't be supporting all the people that haven't yet achieved their diagnosis. And more to the point, if early support helps people to have a less bumpy ride because they're on a different trajectory right from the start, and we believe that that is true, then you have to give people a timely and accurate diagnosis at the first opportunity. Therefore, improving primary care diagnosis is also a no-brainer. And you have to do it now. You can't wait for 10 years to do that bit. And thirdly, strategically, if the workforce that provides the services is not there and well educated and feeling confident and able and supported to deliver these interventions, well, you can have as many planned interventions, you can have as many funded interventions as you like, but the workforce won't be able to deliver them. So strategically, the leadership and advisory group thought that these three were the next top priorities to deal with, and we should get on with them. It does not mean that we shouldn't also start thinking about the others. It just means the next cabs off the rank should be these. And that's my understanding of where those came from and why they make sense. So I've got a question. Is there a plan to put more money into primary care so that GP practices are more able to assist with diagnosis? Indeed, that is one of the suggestions. In fact, most of the suggestions on the table currently about how to tackle this problem involve more resourcing. But at the moment, we haven't started that work. So we'll just see where the primary care liaison group that has been set up by Tohatoha and Tatou and the ministry, what their advice is to the leadership and advisory group about how to take those ideas forward. Where are you gaining new ideas for different forms of respite, like home share, for example? Well, we're not inventing them out of the air. So we hope that some of the many people that have put in registrations of interest for demonstration or pilot projects from government as part of the process that's just finished, that the leadership group and the network were involved with. We hope that some of those registrations of interest are indeed for piloting innovative respite. But the leadership and advisory group is not running the process for deciding on which of those demonstration projects will be funded. That's being done by an expert group pulled together by Tohatoha and Tatou. So we'll be waiting with great interest what comes out there. So hopefully there are some good ideas in there, and then the leadership and advisory group and the network will have to respond to what's being funded and work out if there are any really significant other gaps that we can in respite that we should try and plug in a different way. Now, someone wanted, what is, when we're referring to whānau ora, what is the Dementia Action Plan referring to? It's referring to whānau ora, as I understand it, Macarena and Teresa, with a small w and a small o. So the concept, not a particular funded program within Mana Tohatoha, the Ministry of Health, or Te Aku Whaiora. It's an ethos. It's this idea that from a Te Ao Māori perspective and from a tikanga Māori perspective, it doesn't make sense to talk about a person with dementia and try and target them with interventions, or even a nuclear family, even a person with dementia and their care partner. No, you have to think there's a whānau that are living with dementia here, and your whole approach has to be towards them. And moreover, instead of being a mate wareware primary focus, even though that is the diagnosis that one person in that whānau has, it's a whānau ora emphasis. How can we boost the well-being of this whole whānau, which may include, a medicine to improve the cognitive function of an individual with dementia, but it includes a whole more holistic way of trying to approach the problem. So small w, small o. Would that be right, Teresa, Macarena? Is that your understanding?
Yeah. Yes, absolutely. You hit the nail on the head there, Matthew. And this is consistent with our traditional way of caring for our, for our loved ones, for whānau member who might be suffering from whatever. And it is the stories and the narratives that we've been hearing from whānau right across the motu. So it's an ethos that works. It works not only for Māori, it actually works for everybody. So yeah, that's exactly what we mean by a whānau ora wraparound sort of package, if you like.
I'm going to suggest a change to the program a wee bit. If you can join a breakout room, if you can see it, please join one, and we'll leave you in one. We'll leave you just to do two. We won't bring you back again. We'll keep you in that session for a period of time. And what we want you to do is to introduce yourselves, to discuss the 3 priorities and identify which of those would be most significant for you. And then basically to start to look at what's already working well in your area and for that priority, what's already happening in the country that's working well, and what might work well if it was rolled out nationally. So you're starting to identify, this is the priority of interest for this community of interest. These are the things we know about already in the country that are working well. These are the things that might actually work well if we could roll it out nationally. And then we'll come together as very briefly as a plenary. Please identify a spokesperson note taker, Please identify a note taker and keep those notes and send them to the Secretariat, to the New Zealand Dementia Foundation, and they will be available to you at the next meeting, because you're going to continue that discussion at the next meeting before you report back to the leadership group. I'll just go through that once more. Basically, if you're able to join a breakout room, please do. If you're not, we will go through you one by one and manually put you into a breakout room. When you're in a breakout room, please introduce yourselves, talk about the 3 priorities and which one is the most significant for your particular community of interest, and then start to think about what's happening around the country that you know of that is already working well in this area, and what could be done that might be transferable nationally. Is that all clear? Okay, so please, if you can join a breakout room, do so.
Can I just add to Stephen's instructions there? Please, your note takers, please photograph your notes and send them to me at the New Zealand Dementia Foundation at ceo@nzdementia.org. We'll put that up on the screen later as well, and we'll collate all the discussion that you have today, because there's going to be a second discussion at the next meeting where you really drill down into those priorities and work areas that you identify today.